Let's be clear. Based on yesterday's data, we have about 45 people in hospital in Alberta with COVID-19, about 10 in ICUs out of that 45. That is in a province of 4.4 million people. I want to commend Albertans for the tremendous personal responsibility that they've demonstrated through the past 6 months and the real patience and discipline that they've exhibited. I'm proud to say that Alberta has had the least restrictive public health measures in North America, I think with the exception of South Dakota. And yet through most of the last 6 months, we've had amongst the lowest levels of infection hospitalizations and COVID fatalities of the large population Canadian provinces and the US states as well as Europe. So we've done very well. We should be concerned about the recent increase in the total number of active cases. But ultimately, Alberta's belief is we're not going to micromanage our way out of this. We're only going to get through this if people exercise personal responsibility. And that's what we call on Albertans to do. We think based on the advice of our Chief Medical Officer, currently have the right set of public health measures in place. And one thing I said to the legislature back in May was that we want to do everything we possibly can to avoid jerking around people indiscriminately shutting down their businesses, their jobs, and their livelihoods. We have to be focused on the imperative not just of saving lives, but also saving livelihoods, because the ultimate downstream consequences of constantly shutting down businesses and laying people off will be depression, potentially addiction, huge family challenges, pushing people into poverty, and that is unacceptable. So we have to find the right balance. I think generally Alberta has done a very good job at that. Of course, we'll take on board any future advice from the Chief Medical Officer of Health, but at this point, I think Alberta has done a very good job of preventing the spread. And let me finally remind you again of what I said to the legislature in May, that the average age of COVID-19 related fatalities in Alberta is 84. The average life expectancy in the province is 83. And the vast majority of those who we've lost to COVID-19 were not only at the average age of 84, but they had one or more chronic health conditions or comorbidities. And so the real challenge for us is to protect the most vulnerable, particularly seniors in congregate living facilities.